Magnesium is required to maintain the smooth muscle relaxation in the blood vessels. The requirement for magnesium increases with physical and emotional stress, both of which are known to trigger episodes of Raynaud's disease, and there's some evidence that levels of the magnesium in the red blood cells from women with Raynaud's disease drop in the winter compared to the healthy controls. Low magnesium levels can increase the smooth muscle contractility in the blood vessels, which is important because blood vessel constriction is an important aspect of Raynaud's disease. One study found decreased serum magnesium levels were more common in women who experienced Raynaud's disease when exposed to cold than in healthy women. Studies evaluating magnesium infusion in women with primary Raynaud's disease found that it helped to normalize the levels of magnesium, as well as the levels of certain hormones, proteins, and enzymes associated with the condition. The powerful antioxidant N-ACETYLCYSTEINE supports the production of glutathione, and this in turn helps to prevent damage to the blood vessel lining. A small study in 22 patients with Raynaud's disease, secondary to systemic sclerosis, found that those who were receiving a continuous 5-day intravenous infusion of N-ACETYLCYSTEINE had fewer and less severe attacks. In another study for 2 years, patients who received 15 mg per kg per hour of intravenous N-ACETYLCYSTEINE for 5 consecutive hours every 2 weeks. The researchers found the treatment enhanced the blood flow in the hands, and it reduced the severity and the frequency of Raynaud's disease attacks, and it increased vasodilation. In another study, 50 patients with systemic sclerosis received N-ACETYLCYSTEINE infusion every 2 weeks for a median duration of 3 years, and they reported the therapy was beneficial for Raynaud's disease, and the finger ulcers related to the insufficient blood flow. Reductions in the frequency of attacks, finger ulcers, and pain were also observed. Yohimbe is derived from the bark of the Yohimbe tree. It's a chemical that blocks the alpha-2 receptors, and these are involved in vasoconstriction. The use of this compound in Raynaud's disease stems from the observation that patients with primary Raynaud's disease show abnormal alpha-adrenergic response. In a lab study on blood vessels from 50 subjects who underwent hand surgery for reasons not related to vascular disease, it was noted that Yohimbe reversed the cold-induced blood vessel constriction. Another study enrolled 23 patients, and after cold-induced primary Raynaud's disease was triggered, the participants were randomly assigned to receive one of the following treatments: an intra-arterial infusion of Yohimbe, the alpha-1 receptor blocker Prozicin, or the 2 treatments combined. And the authors reported that fewer fingers overall developed attacks in the Yohimbe group and the combined treatment group than in the drug group alone. It should be noted that Yohimbe may cause a fast heartbeat or elevated blood pressure in some individuals. Vitamin C is also known as ascorbic acid, and it's important for the synthesis of collagen, a key component of the blood vessel walls. In addition, studies suggest vitamin C supplementation improves the blood flow, and there's also evidence that people with Raynaud's disease have low levels of ascorbic acid. In one study, researchers found that median plasma levels of vitamin C were 4.8 mg per litre in patients with primary Raynaud's disease, 2.5 mg per litre in those with limited cutaneous systemic sclerosis, and 6.8 mg per litre in those with diffuse systemic sclerosis. All values were significantly lower than the 10.6 mg per litre that was observed in the healthy control subjects. Another study found 500 mg per day of vitamin C for 30 days promoted vasodilation and improved the blood flow in people with coronary artery atherosclerosis, a condition that shares some of the risk factors with primary Raynaud's disease. Omega-3 fatty acids like EPA and DHA found in fish, and gamma-linoleic acid, which is a healthy omega-6 oil found in evening primrose and borage oil, have blood thinning effects, and this can help to relieve the symptoms of Raynaud's disease. One study found 12 capsules per day for 8 weeks of evening primrose oil significantly reduced the number and the severity of the primary Raynaud's phenomenon attacks. Another study on fish oil found 12 fish oil capsules per day containing a total of 3.96 grams of EPA and 2.64 grams of DHA taken for 3 months increased the time before the symptoms appeared after cold exposure compared to a placebo in primary Raynaud's disease. This treatment also significantly increased the blood flow to the fingers in the participants with the primary Raynaud's disease when compared to a control group that received olive oil capsules. The amino acid L-ARGININE is important for the synthesis of nitric oxide, and this is a potent vasodilator. In 2003, a case report described 2 patients with severe Raynaud's disease, in whom oral L-ARGININE supplementation reversed necrosis of the tissue in the finger and the toes. In another study that included individuals with Raynaud's disease, secondary to systemic sclerosis, the authors reported that warming patients' fingers after L-ARGININE treatment led to an increase in blood flow. In addition, another study showed L-ARGININE administered orally at 4 grams twice per day modulated blood vessel response to the cool temperature in the fingers of individuals with systemic sclerosis. A study on 42 people with low vitamin D levels, an average of 20.9 nanograms per milliliter, and Raynaud's disease reported subjects were receiving 600,000 international units of oral vitamin D3 per month for 2 months, not only achieved higher blood levels of vitamin D than those receiving the placebo, but they also reported that Raynaud's disease became less severe. Researchers speculated that vitamin D functions as a vasodilator in individuals with Raynaud's. Although more studies are needed to evaluate the role of vitamin D in Raynaud's disease, individuals with this condition are encouraged to have a blood test to assess their levels of 25-hydroxy vitamin D and then supplement accordingly to maintain their levels between 50 to 80 nanograms per milliliter. Vitamin E is an antioxidant and it protects fatty acids and other cellular molecules from oxidative damage. Some reports indicate low levels of vitamin E are associated with Raynaud's disease. One study on individuals experiencing Raynaud's as a consequence of working with vibrating machinery found supplementation with 600 milligrams of alpha-tocopherol nicotinate daily for 6 weeks improved the subjective symptoms such as the numbness and the cold sensation. Clinical examinations also indicated improvements. A study exploring the effectiveness of 120 milligrams of Ginkgo biloba extract taken 3 times per day for 10 weeks found the treatment reduced the number of the Raynaud's disease attacks per week by 56%, compared to 27% in the placebo group. In addition, a study on mice found intravenous administration of Ginkgo biloba extract inhibited vasoconstriction induced by the platelet activation, suggesting the ginkgo can also attenuate the vasoconstriction that occurs during an attack of Raynaud's disease. Niacin, or vitamin B3, improves the peripheral vasodilation, and this helps to prevent the formation of blood clots and it modulates lipid metabolism. N-ACETYL hexanicotinate is a compound that contains N-ACETYL bound to 6 molecules of niacin. Within the body, the niacin is released from the N-ACETYL. An 84-day study evaluated the effectiveness of 4 grams per day of the N-ACETYL hexanicotinate in 23 patients with primary Raynaud's disease. The N-ACETYL hexanicotinate group reported feeling better, and their attacks were shorter and fewer compared to the placebo. Another study using N-ACETYL hexanicotinate in 30 patients with primary or secondary Raynaud's disease reported that the severity of the vasoconstriction decreased in most of the participants. Non-smokers responded faster to the therapy than smokers. In addition, elderly participants with long-standing vasospastic disease showed improved blood flow as a result of the treatment. No side effects were reported. The mineral selenium is an important component of several enzymes involved in intrinsic antioxidant defense mechanisms within the body. Low selenium levels can compromise the body's ability to combat free radical damage. Study reports that low levels of selenium in people with Raynaud's disease, and particularly those with systemic sclerosis, suggest supplementation might be of benefit in this population. These findings are particularly important in the context of Raynaud's disease, secondary to systemic sclerosis, since oxidative stress is a significant contributor to the endothelial dysfunction that underlies the condition. For more on herbs, supplements, and natural treatment plans, check out my website.